As Colorado cases and hospitalizations climb, Colorado researchers say they're stumped. And that's after nearly 2 years of working with the state to predict the trajectory of the pandemic. Colorado has good vaccination rates compared to the national average, yet it's still a COVID hotspot right now.
That is the big question right now. And in many cases, it's still a mystery.
Also has some people starting to ask, will this virus ever leave us? Or will it transition to behaving more like the flu and becoming what experts call an endemic? Jeff Todd looking into this for us tonight. And Jeff, the end of a pandemic does not seem to be in sight just yet.
Yeah, Carrie, many experts agree that this virus is going to be with us for some time. It's going to continue to stress workers in facilities like this. But just because the virus is going to stick around does not mean that it'll change classifications into an endemic. We're told because right now there's just too much uncertainty.
We are not anywhere near, I think, where we could begin to call this endemic.
Dr. Lisa Miller spent decades as the state's top epidemiologist. Now she teaches the subject for the Colorado School of Public Health.
We're still seeing huge spikes around the world, and our state is a good example of that.
She says the constant rise and fall of cases means we are still in a pandemic.
You may think that 2 years is a long time, but in the lifetime of a virus, it's not a long time. So it's early, and there is still a lot that we don't understand.
And ways to end the pandemic, like more vaccinations and potentially new treatments like the Pfizer pill announced a week ago.
This virus is the enemy, and we need to think about what we can do to work against that virus. We will get more tools in our toolbox. We will have more treatments. We'll have better treatments.
People sometimes ask me, is the pandemic over? I say, with 1,400 people in the hospital, this is not the endemic state of this virus.
The possibility of an endemic still exists, but health officials say it'll take much more time to know if we're going to have to deal with COVID the same way we do with the cold or flu.
There's still a lot of people that could be vaccinated, and that is the most important thing.
Dr. Miller told us that her biggest concern right now is the healthcare workers, both in facilities like this, but also in those public health departments, places where they faced a lot of criticism while being stretched thin on resources. She says she's hoping that the state can find some way to support those workers who are really carrying the weight of the pandemic right now. We're live in Lakewood tonight. Jeff Todd covering Colorado First.